Hello, we'll be presenting a marketing plan for Biocon. My name is Jake.
My name is Sarah.
My name is Teri.
And I'm Sophia.
First, we will take a look at overview and analysis of Biocon as a whole.
Okay, so for our marketing challenges, we have three parts. And the first challenge we are facing is we are really new to the market and customer have a very minimal knowledge of our company and our product. And there is also existing competition, which is Orthodox. And then we have another marketing challenge, which is affordability, because the income level of the target market is pretty low. Most Indians do not have health insurance as well. And the third marketing challenge we face is our cultural influence, because the expectations regarding our pricing might be low because we're an Indian company. And yeah.
Next, we'll take a look at the market and the segmentation and the target markets we're looking at. The number one priority being head and neck cancer patients. They are the end consumer, and as we know, the consumer is always the most important. The demographic we are looking for is a middle to upper class patient because of the better financial capabilities, because although Biocon is looking to have cheaper medication, for cancer medication, it always is going to be expensive. The next two are going to be physicians and oncologists, both being experts in the field, so they can help build a strong reputation for our brand, and the credibility they hold with patients will allow patients to trust the drug as long as the experts trust the drug. The fourth being government and insurance companies. They are powerful channels to push out these promotional messages and product information that Biocon is trying to get out. The number one competition that Biocon faces is Herbidux. Herbidux is an American company that is established in India. They've developed an in-clone system and have already been approved. Similar to Biomab, which is Biocon's drug for cancer, they target the same main targets. So Biocon is going to be faced with similar competition, and they also have proven results all the way up to phase 3, which Biomab has not reached yet. Herbidux drug produces a skin rash in 30% of patients, as compared to Biomab, which only produces skin rash in 5% of patients.
And for our SWOT analysis, for our strength, we have very strong manufacturing capabilities. We have very high quality products. Our clinical trial 1 results was really good. And we're also early launch and first mover in the market. And our weaknesses is that we lack of local resources, and we have limited experience in the field because we have no prior experience of selling, like direct selling and marketing. And for the opportunity, the overall biopharmaceutical market is really big. The global market is more than 80 billion by the year of 2016. And we are also the first Indian company to sell head and neck cancer drug. For our threat, we have Orthodox as our competitors, and the clinical trials too, we still are waiting to do that. And there will be some cultural differences. And for our data analysis, we can see from the 3 market analysis of mortality rates of cancer. In India, the top one is head and neck cancer. So that's why we are targeting that market. And the next data analysis is on the overall cancer categories, which we can see the head and neck is one of the top incidents that happens in India. And for our financial perspectives, we can see that the annual income growth for the first year is pretty well, is 31.53%, but it decreases to less than 5% the following year. And for our expenses, the material wise, the first year was pretty good. It's around 34.77%, but it decreases to 10% the following year. So we can tell that the product development is slowing down. And on the payroll, we can see the first year is almost 20%, but this following year is negative. So maybe they're having employment layoff, I don't know, something like that. And operational wise, the first year was 34.93, second year is 28, is kind of consistent. And yeah, and then we can go on to our plans and recommendations to fix that.
For our value proposition, Biocon is offering Biomab for head and neck cancer patients in India. And unlike our American competition, Erbitux, Biomab will provide safe and effective products at a reasonable price.
Biocon's objectives are as follows. We want to educate the market to ensure them that Biomab is a safe and effective premium product that is worthy of its high price. We also want to build rapport with our connections of doctors, specialists, oncologists, and gain an authority among patients. We want to increase our brand awareness and develop a strong reputation for our company and our product. And finally, we believe that if we do all this, we will help drive sales.
Some strategies that we recommend a push strategy. We also recommend to expand distribution channels, such as a traditional channel, and also collaborating with government and insurance companies. Also recommend discounts for distributors, such as a 20% off for the first 3 quarters, which will capture more partnerships, or a 15% off the first quarter, which will increase profit margin. We also recommend to expand influencers such as doctors and health enthusiasts, and also expanding in the media, with traditional media and social media. Also paying attention to detailing to oncologists because the specialists have authority and the patients will trust their judgment.
4 Ps are as follows. Our product is Biomab, a head and neck cancer drug that blocks EGFR via targeted biological therapy. We're pricing Biomab at $4,000 per dose. This is priced similarly to our main competitor, Erbitux. Although Biomab shows superior test results, we could easily price the drug higher than our competitor. However, we want to ensure that our customers are able to afford our drug. In terms of promotion, we will provide a discount for distributors, increase our sales force, and educate our end consumer, and all the while improving CRM. We will utilize traditional media advertising as well as influencers and KOIs, which will include doctors and recovered patients. The place is India, our domestic market. We will target government and insurance companies as well as local pharmaceutical distribution channels, as well as hospitals, oncologists, private clinics, and family doctors. Financial impacts are as follows. In terms of the product, we want to increase our plant and our equipment. We also want to continue to do clinical trials to assure that our drug is as safe and effective as we currently believe it to be. Once we're out in the market, we want to further R&D to make sure that our drug is keeping up with new advancements in the scientific field. In terms of marketing, we will utilize both online and offline media expenditures, as well as endorsements from specialists. In terms of operating costs, we will increase our sales force and increase CRM via channel management and good PR.
Some implications and limitations we foresee are implications such as effectiveness, regards to our high quality product, reliability with the clinical trials, having accessibility across several channels, and also making sure affordability with collaboration with government and insurance companies to lower the price for our consumers. Some limitations are knowledge because we are entering a new market. We have no prior references. There are local resources. There are only limited resources in India. There are cultural differences. And there are also market financial capabilities. Some policies regarding restrictions on promotions, as well as a limited budget, which will result in limited marketing.
Next, we'll take a look at some implementations.
In regards to risk and fit with other areas, we'll be entering a new market with no prior knowledge. So we need to learn about the customer characteristics, cultural and traditional influences, the political structure of India, as well as drug regulation and policies. There is also large financial risk because there are large investment requirements, as well as the overall economy growth in India. There will be risk if the growth rate falls below expectation, because then there will not be enough patients with financial capability to afford the drug.
Time and resources are as follows. For marketing duration, we will engage both in short-term quarterly promotions as well as long-term annual promotions. For short-term promotions, we will utilize traditional advertisements as well as distribution discounts to doctors. For the long term, we will continue to educate the market via social media, as well as influencers, specialists, doctors, oncologists, etc. Our resources include the government funding, insurance companies, logistic companies, hospitals and private clinics, and finally, oncologists, doctors, and physicians in the field.
Next, we'll take a look at the marketing metrics that we will measure success with for Biocon. These 6 are the main, and the 3 most important being ROI, consumer retention, and brand awareness. ROI showing us how much money we are able to make. Customer retention, involving keeping our customers, because we are a new company and a new product release. We want to keep all these new customers that we gain. And then brand awareness being a huge part, because we want to build this brand being a local Indian company.
And for our tactical actions for management, we need to increase the marketing budget, increase CRM, also increase R&D, and provide some promotional discounts, but adjust the promotional discounts accordingly. And we relocate the resources quarterly based on our data feedbacks. That's it.
Thank
Thank
you.
you.
Thank you.
Thank you.
Thank you.